to welcome you to the review portion of NASM's Chapter 5, which is basically called the Human Movement System. If you're going through your material, you're probably going to notice that you'll see HMS a lot, and that's what we're referring to here. So basically, the body as a moving, unit and everything like that. This chapter, if you're going to look at it from a specific perspective, is probably going to relate more toward kinesiology and how there's specific items that you need to focus in on that will show mechanics of the body and basically how movement science really is brought out and in a very more simplistic terminology. So, I mean, it's definitely everything that you're going to be using when you're, in your field, in your career, everything like that. But understanding these things especially the terminology, really sets you apart from somebody else because it just makes you able to communicate with other professionals. It makes you really stand out amongst just people who just are training people to training people and everything like that. So let us focus in on all of this. Now, there are 27 slides, but there is some depth to everything here. So it may take a little while to get through, but it's going to be vastly important for everything that you need to know. All right. So when we look at everything first, obviously, what is the function behind everything? Well, there's a few different things. There is the relationship between your internal and external basic viewpoints versus the environment. All right. So what we're saying there is how internally does the system detect things and externally how does it detect things. So understanding where you are in space, meaning like where your body, not in, understanding where your body is in terms of directionality, positioning, everything like that. That's really going to happen, because then what's going to happen is what the next bullet is talking about is there's this ability to get information that will create changes within your system. Okay, so if you go up and down really quickly and then someone's like, oh, I got really dizzy, well, that's the human movement system or just the body detecting that there's what we call baroreceptors, and those detect changes in positioning along with mechanoreceptors, everything like that, and chemoreceptors, which chemically that makes a difference there as well. But with baroreceptors, they'll change and start messing around with blood pressure, particularly. So when you go from being, dropping down and coming back up in like a really quick squat or something like that, people wonder why they're getting dizzy or anything like that. It's because these baroreceptors had a sense of change in positioning and caused a change in blood pressure. Therefore, it made them feel super uncomfortable, and they got close to passing out, stars or whatever it may be. So that's just one example of that. And then what also is happening is it's like a cycle. You're gathering information, and then what you end up doing is you're producing what we would call an appropriate response or an appropriate movement. Okay, now motor response, we're talking about movement for that case. So we are definitely, that's something that we're going to really work with in terms of this huge vicious cycle. So what we want to do is we want to look at different pathways. Now, if you've ever taken an ex-phys class or anything like that, it's going to, this is what we would call afferent and efferent or efferent pathways that we're going to have. Afferent is sensing, so this is based more towards sensory, and this is more toward motor or movement. Okay, and that's really what we want to understand is that, yeah, we want to know where we are. Okay, then we want to detect things to then make the appropriate movement response. Now, if you're going up and down a hill, then you're going to have different sensors that are going to detect that incline or decline has occurred. So we need to focus in on that. So that's going to be one of the important things with that as well. So without appropriate sensing, we can't get appropriate movement. And that's really how we're going to optimize our people. That's why when you watch somebody who has a dumbbell in their hand or anything like that, and they're struggling and they're shaking, with a light weight, and you're wondering, wow, that's really light. Why? It's because the sensing is not creating the sensory input is not creating a proper motor output. It's because there's a disconnect. There's a lack of what we would call synchronization. So that's really important for that. In terms of, so I said kinesiology. There's also another term that we can throw out there called biomechanics, or understanding how, basically you produce and adapt to the forces that are acted on your body. Okay, so because of biomechanics, we're going to go through some really basic and anatomy like terminology just to understand what it is that you're talking about. So when you're looking at like a workout video, or you're reading something in a manual, or whatever it may be, all right, you're going to have this ability to be able to effectively communicate. Number one, use the words with your people. That's really important, because you don't want to just have this vocabulary and not be able to function with it. You want to be able to take what you know, move on to what it is that you're talking about, but use those words so they understand what that means. All right, it's no different than a teacher. A teacher is going to tell you, like what I do right now is I'm telling you words that you're going to want to understand. Well, then you can become effectively communicative with me. All right, so that's where it really becomes very, very important, and that's why effective communication, there isn't a loss in terms of what you actually mean. Okay, so let's go to the first one. So let's talk about some anatomical locations, and this is pretty straightforward. Superior, that means above, okay, above a reference point. So the most superior portion of your body would be your head, or or your skull. All right. Um, Inferior meaning below. Okay, so the most inferior obviously is your foot or your toe or your heel. Okay, proximal basically means closest to the center of the body, or a point of reference, whereas distal means further away. So when we talk, when you go through and learn about, anatomy in terms of different muscles, there's a proximal and a distal attachment site. All right, and that one is more centrally located, one is further away. Okay, and then also in terms of obviously positioning, we're talking about anterior, which is front of the body, or more. If someone says more anterior, that means that if it's posterior and it's more anterior, that means it's not directly to the back, it's more moving toward the front. Okay, and then there's the opposite, posterior. Okay, posterior meaning on the back or toward the back. Medial meaning more toward the midline. Okay, so if you were to look at your quadricep muscle, there's the vastus medialis. That is the quadricep muscle that is on the inside part of your leg. It's one of the four, obviously. And then you have your vastus lateralis, which is lateral or on the outside, okay, or away from the midline. Okay, so those are really, those are pretty easy terms to kind of grasp onto, just and then I think with the CPT exam, you're definitely going to have these terms thrown out there, so you need to know them, and then you're going to be able to use these on a day-to-day basis. Okay, now a couple of them that can get a little tricky, but they're not really, but you may not use these as much, but I definitely think that superior, inferior, proximal, distal, anterior, posterior, medial, lateral, all of those are going to be pretty common. Contralateral, on the other hand, is just the opposite side of the body. So if you're going to turn, and take your neck and turn to the left, there is both ipsilateral, same side, and contralateral contraction of muscles. Because what that means, if you're going to turn to the left, that means you actually may use some of the right side or opposite side of the body, or right side neck musculature, to move you to the right. Excuse me. If you're moving your head to the right, then you'll use left side musculature. I'm sorry, I got right and left confused. So that means you're using opposite side. If you're moving to the left, you can use the right side. Okay, whereas ipsilateral means same side. So if you're turning your head to the left, you're going to use left side musculature. Okay, so just contra, opposite, ipsa, same. Okay, that's what we're looking for there. Okay, some of the other aspects in terms of with motion, we're going to talk about planes, axes, and then joint motions. Okay, so what we need to understand is that the body is broken up into three planes that provide motion. Now, those three planes work around a specific axis, okay, an axis of rotation, okay. So those planes are going to dictate what type of movement you're actually doing. Now, in research, there has been a lot of really good research that we've seen where um, keeping a person in single planes of motion, meaning forward or backward, side to side, or rotational, keeping you always working in one plane of motion is non-beneficial. And one of the things that you know NASM really hits on is being having integrated training or systematic integrated training. And what that means is that you're going to be using a lot of different modalities, a lot of different types of exercises, a lot of different things that motion, movement, and everything like that. Well, being systematic and integrative means that you're going to work in all three planes of motion. So doing a squat is great, but constantly squatting, you're only staying in one plane of motion, which is forward and backward, which we'll talk about in a second. Okay, but what that means is we want to be able to do things that can test our frontal or side to side motions or our rotational motions. So there's different movements that we can do to talk about that, and that would be something that we would talk about in other chapters. Okay, but understanding right now that we work in a plane of motion, and here's the three. Okay, um, let's kind of blow this up. Let's move this a little bit. All right, and let's blow this picture up a little bit, just so you have a better indicator. Now, first one is sagittal. Okay, sagittal basically, to make it really simple, it cuts your body in half onto right and left sides. Okay, so what that means is that you have a right side and a left side of the body, and they obviously can both work independently. So you can use two, bilateral exercise, meaning two arms or two legs at the same side, or you can go unilaterally, one side at a time. So that's one of the cool things about the way that sagittal work. Well, any of them really work, but with sagittal, what you're really looking at is front to back. Because you're cut in right and left sides, everything that you're going to be doing is going to be front to back. So a squat, your hips are flexing and extending. Okay, when you go down, your hips are flexing. When you come up, your hips are extending. When you do a forward raise, a forward dumbbell raise, you got the dumbbell in your hand and you're lifting your arm straight up in front of you. That is a sagittal motion. You're going through shoulder flexion. Okay, so that's this right here. So if you see my arrow right in the middle, that's the sagittal, right and left sides. Okay. When we talk about the frontal plane, which is the next one, you're basically cutting yourself, you know, in half, but from front to back, meaning it's going to kind of cut through your ear and cutting yourself into front and back sections of the body. Now, with your bisecting of front and back, or to make front and back sections, what you're actually doing is you're creating side to side movements. Now, two major functions are what we call AB, B as in boy, ABD, abduction, and ADD, D as in dog, abduction and adduction. And what that is if you were to take your hands, put them on your side, and then lift your arms straight out to the side without bending the elbows, that is called ABD, abduction. If you were to take the same thing with your legs, if you were to stand up straight like a soldier and then lift, just say the left leg out to the side with only moving the hip and the leg, then ultimately what you're seeing there is hip ABD. Now that's abduction, that's pulling away from the center line. Now, adduction, think about adding it back to the center line. What you're going to do is you're going to put your arms, so it makes you into like a T, and then bringing your arms back down to the side. That is ADD, adduction. Whereas same thing with the leg. If your leg is up in abduction, if you bring the leg back to the center, or ADD, adduction, then you're basically bringing the leg back down to the center, and that means that it's returning back to where it was. And you can actually cross the center line if you really wanted to, meaning like if you were going to do like a band around the ankle, and you're going to start the leg out and then bring it in toward you, and then it comes across the center line, that's still adduction. Okay. And then lastly, we talk about the transverse plane, which is an arrow over here to the right. All right, that's the transverse plane. The transverse plane cuts you or bisects you basically between where your center of gravity, center of mass is. So roughly around the belly button region, so in the abdominal region, all right, depending upon your, symmetries of your body. And by cutting it in the upper and lower, what you're doing is you're creating an effect where you can do rotation. Okay, so you can rotate the spine, you can rotate the hips, you can rotate the shoulders. All right, all of those areas can be rotated. So if you were to do a lunge, okay, if you were to lunge forward and backward, that's sagittal plane. If you were to lunge, if you're going to do a lateral or a side lunge, all right, you're going to be working in the frontal plane. And then if you're going to do transverse, what do? You would make a rotation with your feet and rotate out to the side, and then rotate back. That's an example of a transverse lunge or a transverse plane lunge, okay, or a rotational lunge. Okay, so that's how we work with rotation. Now, internal external rotation, think about throwing a ball. When you kick the arm back and rear back so you're going to be able to throw, that's external rotation of the shoulder. Okay, and then when you throw forward, you have internal rotation of the shoulder. So those are ways that you can think about rotation and how they are, you're basically cutting the body into upper and lower halves. But if you were to take and just understand that where the rotational points are throughout your body, the hips, the shoulders, the wrist, all right, all of those areas can have rotation to them. But if we're looking at gross movement or large movements, yeah, then we're talking about rotating of the spine, rotating of the hips, rotating of the shoulders. Okay, and that's those three: sagittal, frontal, and transverse. Okay, and then there are two more. Okay, horizontal ABD and horizontal ADD. Okay, horizontal ab and adduction. Okay, now it sounds exactly like what we talked about with ab and adduction, bringing things out and in, things away from the center line and then toward the center line. But the difference here is the actual movement, all right, and how it is a transverse plane motion, because even though we are basically in um, and it's really it's a combination of transverse and sagittal plane motions. So think about it from the perspective of you put your arms out straight. So you take your hands and you go into 90 degrees of shoulder flexion. So now you're, if you have both your hands out, you look like you're walking like Frankenstein. That's where think about your arms in that way, or a zombie or a mummy or something like that, where they're like coming after you. Horizontal ABD. Horizontal abduction is if you were to have your arms in that straight out position, and what you're going to do is you're going to take and horizontal, like across like the horizon, you're going to just bring those arms out to the side. So now your body looks like, if you're standing straight up, it looks like your body is in a T. Okay. And then horizontal adduction is bringing that back to that Frankenstein looking arm position. And that's basically, again, going across the horizon. You're not bringing your arms up and down. It's just your arms are in 90 degrees of shoulder flexion, which means that they are out in front of you. And then you're going horizontal abduction, which is taking you out to that, like I said, it makes your body look like it's a T. And then horizontal adduction is bringing it back to where it was. And that's what we're talking about there. There are other motions for different areas, like the scapula. Okay, now here again, we'll kind of bring it up a little bit here, and get the words there. We go a little bit bigger. So when we're looking at this image here, this is, and I'll go bigger than because we can see everything here, but we want to see what's going on. Okay, so A. So A is the first one. This is what we would call scapular retraction. So if you think about being on a rowing machine, or think about rowing, like doing a seated row on the little on the equipment that you have at a gym, and you were to take and outstretch your arms, grab the bar, and then bring it back toward you, and as you're bringing the elbows back, you're actually thinking about squeezing the shoulder blades together and creating a credit card reader. That's scapular retraction. The scapula are actually rotating backwards. Okay. in terms of the second one, which is scapular protraction, instead of squeezing the shoulder blades back, what you're going to want to do is you're going to want to almost create like a forward pull, like you're trying to pull those scapula forward, and you're creating like this. It's not a hunchback, but what you're doing is you're actually making it look like you have like gorilla or ape arms, and you're trying to pull it forward, and you're trying to basically squeeze the shoulder blades in an anterior or forward positioning, and that would be letter B. Scapular depression is where you're actually rotating the scapula downward, and basically if you were to sit up tall and you were to take your arms and sit up tall on a chair, put your arms to the side of the chair, and then make a fist, and then try to drive that fist down into the ground, you can feel your shoulder blades rotate down. All right, that's how you can do that. And then scapular elevation. Whenever we talk about scapular elevation, all I think about is I don't know. Okay, so when you say, you're like, oh, I don't know, and then you lift your shoulders up and make that, shrugging motion, that's scapular elevation. You're actually elevating the scapula or rotating the scapula upward. Okay, so ultimately, these are all motions that affect the scapula. And now, protraction and retraction that can happen at the jawline. All right, you can basically move your jaw in a protractor, try to bring your jaw forward, and then retract it and bring it back toward your ears. That's how you can do that as well. Okay, so that's another area that you can do that for. All right. So, now that we've kind of hit on the actions of everything, the muscle actions, let's talk about, not the muscle, joint actions, excuse me. Let's talk about muscle actions and how we can get those joints to move in specific ways. Now, there's 3 different types of muscle actions that we have that we'll discuss for your testing, okay? Eccentric, isometric, and concentric, okay? In no particular order. So really it depends on starting position and everything. It depends on the muscles that you're using, because it doesn't mean that everything starts eccentrically, and it doesn't mean everything starts isometrically or concentrically. This is just the 3 of them that we want to talk about, and we'll give a couple of examples on how to make this work. Okay, so with muscle actions, we want to understand that when you're trying to do, and I always like using a bicep curl because everybody understands the bicep curl. Concentric, eccentric, isometric, eccentric, isometric, concentric. Let's just talk about it. All right. So just say you have 10-pound dumbbells in your hand, and they're down at your side, and you're getting ready to curl the dumbbells up toward your shoulders. Okay, like you'd be doing a bicep curl. What has to happen there is you actually are contracting your muscles slightly during that time. Okay. There's no change in muscle at that point, but you may be slightly isometric, which means there's no size change, meaning there's no length change, but you're stabilizing those muscles in your arm and in your shoulder to hold on to that weight. Okay, but there's no lengthening or shortening. There's no movement at that time. Okay, but there is contraction. Now, when you take the dumbbells and you want to start moving them toward your shoulder blades, what you need to try to remember is that that's going to be a muscle, what we would call shortening, to then move the joint, or to move or the levers or the bones that are connected to that muscle. Okay, so let's put it this way: you have the dumbbells in your arm. You go and you start squeezing to bring the dumbbells up toward your shoulders and create a bicep curl. That is concentric. That is the actual muscles shortening, meaning they actually move closer together, and that's where force production occurs. Okay, so now the dumbbells are up to your shoulder, and you're getting ready to return them to the starting position. Well, right in that interim between that upward motion and then the return, you are actually holding those weights there for a short period of time. Now it depends on what you might be doing. If it's muscular endurance or hypertrophy or strength, if you're working with tempos, it might say to hold that weight there for 2 seconds. Well, if you're holding that weight there for 2 seconds, The muscle is still contracting, but there's no length change, which means you're isometric. Now, think about isometric too, where if you walked up to a wall and you tried to push into the wall's not moving, but your muscles are contracting in your shoulders and in your pecs to be able to, try to push into that wall. That's isometric. Well, the same thing is happening with the bicep curl. Weight comes up, stops, you're holding it for 2 seconds. That 2 seconds is an isometric hold, just like you would be doing a plank. Okay? That's how that's going to work. Okay? So that is slightly different in terms of, and it's slightly different because you're actually going through a motion, but because there's no change in length, that's isometric. And then when you return it back down, again, if there's a tempo to it, you want to make sure that the tempo stays the way it's supposed to, okay? And that right there will create a change for you all, and that will make it so that you can basically be able to return it back down. It'll be a slowing effect, but you still can get some contraction within the muscles to create, more force. Even though it's force reduction, that force reduction is causing a stimulus of the muscle. And that's why a lot of times what can also happen too is with rehabilitation, like if you were to just say you get a job in a PT clinic or something like that, you're able to use eccentric training because the load is not so great, but because it's force reduction, you're still trying to decelerate everything. You can provide some more force than what you might think, so you can use that correctly. Okay, so just kind of keep that in your back pocket. Okay, so with everything here, we know that there is eccentric, concentric, and isometric ways that we can work through a spectrum of muscle actions. Okay, um, understand that because of the way that everything works, you're going to be working in specific planes of motion, but predominantly, no matter what we do throughout the land of fitness, exercise, wellness, we do work predominantly in the sagittal plane. I mean, just walking alone, walking, running, all of that is in the sagittal plane. It's forward and backward hip motion and shoulder motion. All right. So understand that we don't want to work predominantly in one plane of motion, but our body naturally does go in that motion, but we can adjust that and do different things with, like I said, our exercises that can help us modify and create different stimuli and hit different muscle groups. Okay, so with muscle force, there's some things that you kind of want to pay attention to. One of the things is by with muscle force, the main thing that you need to understand is that obviously muscle has to pull onto bone, but that's the key word there, and that's pull. Muscle pulls, it doesn't push. Our bodies push things. Our muscles always pull. Our muscles always pull onto a specific joint, meaning bone or bones, that will allow you to be able to move in a certain way. Okay? So what are we saying here though? The definition truly, what force is defined as the interaction between two entities or bodies that result in either the acceleration or deceleration of an object. So do not always think that things have to speed up. We have to slow things down. Think about walking up and down stairs, excuse me. So if you're walking upstairs, you're accelerating. You have to be able to get your body to move up or up those stairs. And you have to accelerate, meaning you have to provide more force in a direction of upward motion so that you can accelerate upward. Now, going down the stairs, you still have to provide a force to slow the body down because you're going to be going in a downward fashion, but you're also having to decelerate and overcome gravity pulling you in that opposite direction as well. So that's why it can become a little bit challenging. All right. But what is really cool is that our body is able to basically manipulate forces that are constantly pulling on our body and then be able to create a desired effect or a desired movement that is forceful, it is appropriate, and it's in the right direction that we're looking to go in. So by understanding muscle force and understanding specific relationships that we have with force, we can kind of develop a better understanding to how we can help people depending upon what their goals are or what they need in terms of correct movement patterns. Okay. So something to think about here is what we would call length tension relationships, and this, these relationships that we're going to talk about in a second here, they're going to be something to understand that are going to pop up on your test because they really like to emphasize these. Okay, so what we're talking about with length tension is that there is a certain length that the muscle wants to achieve that it will create the necessary force that you need to have. Too much lengthening, too little lengthening, and you end up with bad movement. You don't end up with a very forceful movement. Now, there is a desired length tension relationship, and everybody is different with that. But if you look at this picture here, what we're saying is that with now these terms here, actin and myosin. Actin is the blue lines, myosin is the pink lines. What those are what we would call myofibrils, and those myofibrils are what help us to basically create a ratchet effect where you start pulling what we would call the sarcomere, which is the end of the blue and the end of the blue, closer together. Okay, so when we look, see where it says resting length? That resting length means that that's where you are most optimal in terms of at rest. There is minimal contraction, meaning there's minimal connection between actin and myosin at that point at rest, meaning that it shouldn't be connecting because ultimately there's no need for contraction of those particular muscles. When you have force, we want to make sure that see how we have the short, here's the resting length of a particular, the middle here. So if you follow my arrow, right in the middle here is a resting length. If you see here how this is shortened, that means that there was a specific force applied to that muscle. Now over here on the right is the far end of this length tension relationship where you are too relaxed, and that means that there will be no force production at that point, zero, because there's no overlap. Resting has some, and that's because our bodies have to, so you understand how the wording is done correctly, our bodies have to have what we would call tone, muscle tone. And that means that there's nervous system impulses that are sent to our muscles that allow us to basically stay in a slightly contracted, so you don't topple over or basically fall into some heap. Because if you're sitting up, that there are muscles that are constantly under contraction, but it's light nervous system impulse that creates muscle tone, meaning that the muscles will stay semi-contracted. But when you go into a forced, we're trying to put force output out there, that allows you to be able to create maximal force or submaximal force depending upon what you're trying to achieve. Okay, that's length tension. And as the length changes, the tension will change depending upon what length it is. So the shorter the length, the more tension can be developed. The longer the length, the less the tension is that's going to be created. Shorter, and then over on the right is longer. On the other end of the spectrum, we have what we would call the force velocity curve, another relationship. What we're saying here is that at certain points, as really it's obviously a relationship between force and velocity. So as something speeds up, okay, the ability for force to increase is actually decreased. Okay, so let's use the example of a car. Okay, you're on the highway and you're driving down the highway. Just say that you're doing 70 miles an hour. Okay, now in Florida that's legal. In other states that's not. Okay, but anyway, that's neither here nor there. So what happens is as you're moving at a specific, a certain speed or a certain velocity, what you are realizing is that you've already achieved a certain, you know, directional speed. You've already gotten to a certain point. And so you're doing 70. And you're like, okay, well, I want to pass this truck because it's got rocks coming out of the back of it. And so you go to hit the accelerator. Well, going from 70 to 75 or 80 can be, with the motor is really hard to produce extra force with that. So your motor has to work a little bit harder. Okay, that's what we're saying there is as velocity of a concentric muscle, a muscle that is shortening, increases, the ability to produce more force decreases. So that's the force velocity relationship between concentric. On the other hand, as velocity of eccentric muscles increase, the ability to produce force increases, which sounds kind of crazy, but it's the truth. So that's why people, when they are, when they're doing plyometrics, that's why you're building up, as velocity changes in eccentric, it's able to create this counter effect of an explosive jump, and like a plyometric jump, all right, because you're absorbing and then releasing, all right. So we need to also realize too that force changes with velocity. So as a muscle moves quicker in terms of concentric, it's going to decrease force. As eccentric muscle contraction increases, the velocity of it increases, so does the force. So that's why eccentric can be really important. So like if you're in a squat, for example, and just say that your maximum weight you could ever do was 400 pounds. Well, if you put 400 pounds on a barbell and you're eccentrically, contracting, what's going to happen is you can actually use that eccentric to help you to get to the bottom of your squat and then immediately come back up because you've been able to produce higher amounts of force. Okay, and you can overcome more amounts of force. So even though the velocity is increasing, the ability to produce force is also increasing. Okay, so that's one of the cool things there. Now, force coupling, what we're saying here is this is a little bit different. This just means that muscles are coupled together to create optimal force depending upon what movement you're trying to do. Okay, now depending upon the location, they give you the example here of the scapula. And what you're looking at here is, if you look at I'll just blow it up for a little quickly here. But if you look, this person is looking to go this is actually true, not horizontal. This is actually true shoulder or scapular ABD or abduction. Okay, this is bringing the arm from a resting position to 90 degrees and then up to close to, not truly, but maybe 140, 150 degrees of shoulder abduction. Okay, and so you'll see here as you look at the red arrows and the little dot. The dot is what we call the axis of rotation. Okay, so you're going to rotate upwardly. Okay, and so depending upon what you're doing, what we're doing is we're actually coupling our muscles together to produce optimal direction and optimal force. Okay, so if you look, you have your mid, over to the left of the picture, you have your mid and then your lower traps. You have your serratus anterior, which it looks like the little claws coming out of the side of your, of your rib cage, and then the upper traps. Now, because of the shoulder wanting to, rotate, if you look at the red arrows, that's the shoulder, the scapula actually wanting to rotate. These muscles keep that scapula in line. They provide maximal force to be able to then move the arm in an abducted format. Okay, so that's really cool that you're using 4 different muscles to create one very smooth motion, and that's what force coupling is all about. You're using specific muscles to make sure that everything creates a proper line of pull, and then it also creates a proper amount of force to be able to, just say you had a dumbbell in this hand, that is, we're going to require more output of force from these muscles. Well, we have to couple them better, and we have to make sure they're all coupled equally so that we can work with that. Okay, so that's one of the good things about force coupling. With leveraging and what we call arthrokinematics, okay, what we're doing here is we're creating a lever system. Okay, and by creating a lever system, we can create different movements and how basically muscle acts on bone to be able to use different motions. Okay, now what we're saying here is that depending upon the motion. Okay, so the left hand here is the left side picture is us talking about a bicep curl. The middle picture here is more about horizontal abduction, okay, or moving, or no, actually, I'm sorry. This is going to be coming from the center line, so the arm would be down, and you're actually abducting. So that's just straight abduction, just like the last picture we saw, coming from the arm on the side of the body upward. And then we have on the right side that is actually shoulder flexion, or basically moving the arm in a forward upward motion. Okay, now depending upon what we're doing here, what we need to understand about leverage is that when you do a specific exercise, our body typically has what we would call a mechanical advantage, which means that our body likes moving in that direction, but it likes moving in that direction at a certain joint angle. Okay? So think about it. When you're doing a pull-up, okay, and you pull your body up. Now, when you lower yourself back down, is it easier? And think about it from this perspective. Is it easier to lower yourself all the way back down and then do another pull up? Or is it easier to cheat that and only go like halfway down and then try pulling up again? And that's actually we're talking about mechanical advantage. When you let yourself down into that halfway point, the actual musculature of that's surrounding the scapula, that's basically, if you want to even call it just, straight lats, the latissimus dorsi, you know, you're putting your lats in a very mechanically advantaged position because it's saying, "Oh, I like this. I don't have to overcome being all the way straight armed, and I can pull myself back up." And that's a lot different than anything else. Okay, so understanding that there is specific leverages that we can provide to our joints that will make them move better. Okay, and then if you look at uh, our diagrams here, we're basically moving in different axes of rotation, and so because of that, it just depends on for most part, again, sagittal plane motions are better because they're a little bit more leveraged and it's more equally balanced. Whereas if you were to move in a frontal plane, it's going to be a little bit harder. If you're going to move in a transverse plane, it's going to be a lot harder. So that's where that's why when you're doing a forward lunge with dumbbells in your hand and you have 50s in your hand, you try to do 50s with a side or lateral lunge, it's a lot harder. All right, because the leverages and the bone to muscle interaction is a lot tougher. It's not optimal for our body to be in, and that's what we're talking about here. Okay. So some of the things here that we refer to in terms of motor behavior is that you've seen the term kinetic chain before, that again from head to toe. All right, is with motor behavior, what are we talking about? It's basically how do we create and then how do we learn specific movements. Okay, and that's the motor behavior part of it. Now with motor behavior, we talk about what we call motor control or motor learning. All right, so with motor control, we're talking about how, like it says there, how the nervous system, CNS, the central nervous system, brain, and spinal cord integrate internal and external senses or sensory information to produce the desired movement or motor response. That's what we're talking about here. Motor control is that it's taking, and we kind of talked about this at the beginning of this lecture here, is that how do we take information that's being presented to us from the internal and external environment, and how do we change what our body is thinking to be able to move effectively? And that's what we're referring to here. That's motor control. Okay, so because of that, what we end up with what we would call muscle synergies, and that is basically saying that the nervous system is going to create groups of muscles that love to work together so that you can move effectively in a specific desired effect. Okay, so for example, here we have to have synergies. Now with the squats, they give you the quads, the hamstrings, and the glutes. Well, you're like, well, the hamstrings they don't work correctly in a squat. That's quads and glutes. Well, that is true. But you also need to understand that the hamstrings have to be able to stay, you don't want to call them contracted, but they have to be available to you because they have to be ready to be able to descend the body down in a squat. Well, if those hamstrings aren't, firing, not like you would be doing a deadlift, but if they're firing, then you're going to have a good deceleration or descend toward the floor as you're squatting. And then as you stand up, the hamstrings want to disengage, allowing the glutes and the quadriceps to take over so that you can move effectively. All right, now when you're doing a shoulder press, there's the same thing. The deltoids, the traps, and the rotator cuff musculature, because there's 4 of them, technically have to all work together in a group to fire off correctly so that you can lift that weight up overhead. Okay, that's one of the cool parts about that, is that synergies are meant to be there so that you can move correctly. Think about it too, if you're a person who, just say you haven't squatted in a while, but then you squat with some weight on your back, and then you wake up the next morning and you're like, man, the insides of my thighs, or the insides of my, feels like the inside part of my quads are really, tired. And that's really, actually, most times than not, that's usually your adductors, and those are another synergistic or synergy to a squat, is that they provide stability so that the muscles, when the muscles of the adductors contract on the inside part of your leg, they're contracting because they're not allowing the knees to bow in, and they're not, overbearing and pushing the knees out. Creates proper alignment. So because of that, they're a little bit sore because they haven't been worked very often in that realm. So it's kind of cool that you can kind of think about those types of things and be like, oh, well, that's kind of weird that that would be firing up like that, but it's supposed to. Okay. So, in terms of sensory, okay, this is what we use that term afferent before, or afferent. Okay, those afferent signals that we have, or those sensory signals, typically are found through what we call proprioception, or basically being able to take sensory afferents and then sensing things, and these proprioceptors sense change typically within the muscle, or the muscle, the joint, tendons, soft tissue, ligaments, whatever it may be, and they will provide basically almost like a tattletale, and they're going to tell on somebody that something is not right. Okay, and so, like it says here, it uses the information from mechanoreceptors. Now, those mechanoreceptors, I don't know if they go through. We'll just put those in here, right here. If you ever see the terms muscle spindles and Golgi tendon bodies / organs, that's how they're termed. Okay, those mechanoreceptors, muscle spindles, are found directly in the muscle, and they detect changes in length of the muscle or stretch. Whereas the Golgi, I didn't spell it right. Wow, that was not good. Golgi, the Golgi tendon organs, or Golgi tendon bodies, those are found, like it says there, usually it's in the tendon or tendinous region of the junction between the muscle and the tendon, and they detect changes in tension. Okay, so those are 2 very key mechanoreceptors that are also important for us, so that they detect different changes within those, like I said, soft tissues and within the joint themselves, that will be able to then take and provide, like it says, static, transitional, and dynamic positioning, movement, and sensations that need to occur around the joint or the muscle. All right, and that's really cool. So you have these sensing signals that are sent to the brain to cause you to change something. Okay, so if they're not working correctly, or they haven't been worked correctly in a long time, it's going to take a little while for us to be able to kind of get that back to working correctly. But it will, and when it does, it makes people's movement patterns that much better. Okay, so there's your sensory motor integration. So again, working with the nervous system. So what we're saying here is it's the ability of the nervous system to gather, and then take that information that's been sent to the central nervous system, the spinal cord of the brain, and it interprets it. And then what it does is it executes the proper response, meaning the proper movement. Now, for us, a good way to think about this is, how quickly it happens, number one, because you just don't realize it. But in my exercise physiology class that we teach here at the university, and what my current students just got done taking, they know that the example is attack. So when you step on a tack, a lot of people will step on it and they'll pull their leg back very quickly. Well, they do that because they have a good nervous system signaling system. They are able to sense something changed, didn't like it, brain said move, so they moved. Now, a person who doesn't have good sensory information, they might step on the tack completely, and then it's going to pierce the skin. It's going to create a puncture wound. Then there's more damage that occurs versus just stepping and pulling back. All right. So that's really one of the cool things about that, is that we're able to do that. Well, once we determine the proper motor response or proper movement, then we know whether we need to slow something down, speed something up, we need to stabilize something more, we need to provide more force. So just say that you're, again, going back to your 400-pound squat. Well, just say you're going to do 80% of that, which is 320 pounds. Well, you're going to do that 320 for 5 reps. Well, what's going to happen is on rep 3, the body's like, whoa, this is getting tough, even though it's not your maximum weight. So what's happening is the body is detecting that more force output needs to occur. So what's happening is those Golgi tendons and those muscle spindles are calling out to the nervous system to say, hey, we need more muscle fibers to fire off. So they'll send more signals to allow the muscles to start, contracting like they're supposed to. Then rep number 3 is tough, but then rep 4 and 5 were not as tough as rep 3, because now you've called upon the correct system to then create a change in another system. You called upon the right system, meaning the nervous system, to change your muscular system. So it's that neuromuscular interaction too. Okay, so that's one of the cool things with sensory motor, is that without having proper interaction, you're going to have inappropriate responses. So you're going to have the good responses. Okay. So like it says here, it's only as good or only as effective as the incoming sensory information is in terms of quality. Okay. So again, if you have inappropriate, like it says here, inappropriate length tension relationships, that means that you're not going to move in the way that you're supposed to. Just say that you have really tight hamstrings and you have really strong quadriceps. So you're more quad dominant, but it's causing a tightness in your hamstrings. Well, that length tension relationship is going to basically cause an ineffective movement when it comes to changes that are detected, because you're not in the proper positioning in terms of muscles or anything else, really. So that's one of the scary parts of that, is that you really have to know that your body needs to be optimally aligned. So what we're saying is that if there's any disruptions, then it's going to cause changes and the movement's not going to be as effective. Okay. Proper, like it says here, proper structural alignment puts the body in the correct position to efficiently absorb, distribute, and produce forces. And that's really what we want. So again, if you have tight hamstrings, and you're not really working on your flexibility for those, that's a problem, because ultimately you're not going to be able to absorb force, you're not going to be able to distribute it across multiple muscles, and you're not going to be able to produce the right amount of force because things are so tight. Okay, so the body detects that. Well, what it's going to do is it's going to start calling on other muscles that shouldn't be called on at that point, and then that's when body alignment, like your spinal alignment, hip alignment, that's all going to change, because muscles are creating this change in the joint itself. Okay, so you got to be aware of that. And what they call it, any deviation in the alignment of the kinetic chain causes altered sensory input, and then you have altered motor response, meaning that you detect it like you're supposed to, but you haven't. It's altered because you're calling on things that aren't supposed to be called upon to then move in a inoptimal way. Okay, and we need to understand that that's a problem, and we have to be able to correct that sooner than later. That's why I think it's really important that NASM also has their corrective exercise specialist certification, because that's going to help with changing those things and creating an unaltered sensory input, which creates an unaltered or a better motor response. Okay, so that was motor control. Let's talk about motor learning, or the integration of motor control processes. So basically, what we're doing is we're learning. We're taking the motor control things that we are getting good at, and we're going to practice and get more experience with something that will lead to a change in a behavior or a change in a movement. Okay, and that's really what it is. It's relearning or learning more of. Okay, that's going to be very, very critical for that. Okay, so just kind of think about those types of things when we're talking about motor learning versus motor control. Motor control is making it to what it is, and then motor learning is learning more to make that movement even more effective. So with motor learning, we have what's called feedback. We have internal and external feedback, which we've kind of hit on before. Well, again, the better you get at internal and external feedback, the better it is that you're going to have a change in the kinetic chain that will create better nervous system output or representations of motor patterns or movements. Okay, that's the cool thing there. Okay, we need to understand that with feedback, proper feedback, you're going to get proper movement that comes from it. Okay, and that's very, very important to understand, but it's not as easily said. It's not as easily said as it is done, or it's not. Yeah, that's what. Yeah. So things are always easier said than done, and because of that, this takes time and understanding of the body to be able to then create a better effect. That's why feedback is always, always important. All right. So again, use of sensory information and sensory integration, all right, will help with motor pattern, better representation of, again, permanent neural representation. So again, that person who was lying down and they were doing a chest press with 2 dumbbells, the feedback initially is not good, and that's what's causing that stuttered motion or the skipping or the shaking. But as they learn the right sensory information and the right integration of how to move the body, those motor patterns will get better because the nervous system is able to supply muscle fibers with the correct impulse and that hitting effect, or that, like a spark plug in an engine, and it's creating this good hit and bang. You have this output of force, and that's what you want. Okay, here's your internal feedback. Okay, again, we talked about proprioception. All right, so that's they're there. So incoming feedback is it's basically taken in by the central nervous system, and then, like it says, to monitor movements and their outcomes, and then it's going to provide the brain is going to say, oh, well, this is what's going on. Okay, cool. Well, if the brain understands what's going on, it can make the right decision about how to change for whatever the environment is. Meaning, are you going from a run and then you're going to immediately go into like a few power cleans, like if you were doing like a CrossFit style workout, or are you going from a bench press right into a push-up? Well, there's different positioning effects of that. Well, the internal feedback will allow you to change sense the change in the environment and then make the right adjustments. Now, it's going to be the external feedback that is basically on our end, all right, so that you can say, oh, well, at rep 5, you were noticing that you're starting to get more fatigued on your bench press is fine, but on rep 5, your push-ups are getting, they're getting a little sloppy, or they're looking a little bit slower, and you're flaring your elbows more. Well, that is external. That's what you're seeing. That's what that person is feeling, and that's really what's important about that, is that's the external. That's the or maybe after rep 5, that person has a heart rate monitor on, and it's like, oh, well, their heart rate is almost up to 175. And you're wondering why they're starting to get fatigued. Well, there it is. Again, so the internal feedback is telling you one thing, the external feedback is telling you another, but they should align with the performance. So, if things look super easy, but a heart rate monitor is saying that you're only at the heart rate monitor is saying that you're at 200 beats per minute, and it's like, whoa, what's going on here? So, internal and external feedback will give you that way of helping that person to then make the necessary changes that they have to make the change for. Okay, and then again, external feedback really, as you get better at your job, your external feedback and your cueing and your demonstration and your correction for that person's movement will only become better. So the more as the professional, the more external feedback you can give, but it's also making the client understand that they can detect their own external feedback, because you're showing them what they should be feeling and you're giving them the interpretation of what needs to be felt so that when they feel like, oh, I did that one wrong, you do it all the time, I'm sure, when you're working out on your own, is that you feel something and then you're like, oh, that didn't feel right. Well, you know that because you've been doing it for a long time. So your external feedback is really, really good at that point because you know it doesn't feel right. But that also means that your internal feedback is optimal because something didn't feel correct. So whether the muscles didn't, maybe the muscles didn't fire correctly, or you didn't put out the right amount of force, so things didn't move as quickly, so it felt funky. All right. So those are different types of things for that. But it's really important that we understand the internal and external, and that, it's getting you to understand the internal understanding and how the brain interprets things, and then how things feel versus anything else. Okay. So, chapter 5, some of the terminology is there. It's going to be something that you're going to use constantly, and you need to make sure that you know majority of these terms, the major terms that we've talked about throughout this chapter, so that you can, for your testing, it'll show. All right, and this is a really important chapter because it's another one of those backbone baseline information that will help you to then understand how core musculature works, why we're doing specific resistance training modalities, why flexibility is important, especially with proprioception. So this doesn't just stop here. It's going to come back up in the future. So just keep on it, keep paying attention to it. And then, again, if there's ever any questions, please, 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 please feel free to reach out. But again, I appreciate everybody taking the time to listen to this. And, like I said, if there's any questions, I'd love to be able to help you answer them. And again, move on with this. And again, don't forget about it. Don't just think about the test that you're going to take. Think about, how this is going to relate to everything else in your future. All right. That's it for me. Talk to you soon.